everybody. I wanted to show you how to take blood glucose on a patient. So you're going to have to practice this in clinic. You're not going to have an opportunity to kind of play with this in class since we're all online. But this is the monitor that you'll use in the clinic. These are the little strips that you're going to use. They're in a little plastic vial that's in the center of clinic. And so you just take this and one of these to your, just one, not the whole bottle. You just take one of these to your operatory when you have a patient that is diabetic or pre-diabetic to check their blood glucose. And it's a little tricky. It's very easy to get an error reading, and so you need to make sure that you know the process so that you don't have to use like 5 of these before you actually get a good reading. And the trick is to basically slide it in right when you're ready to collect the blood, and then you can see it's asking for blood, and then you go right in and get the blood. So you just want to make sure that you do the process really smooth and efficiently, or else you'll get an error. So I already did a practice run here, so I'm going to use my middle finger, but generally you use like the patient's index finger, and you want to use kind of the side of the finger because it's kind of padded and thick, and make sure that when you have, looks a little different than the ones in clinic, but they're basically the same, these little the sterile little punctures to get the blood. You want to make sure that after you take out this piece here that you have the bottom firmly pushed against the patient's skin, so that when you push the trigger and the little needle comes out and lances, the little lance comes out and lances the skin, that it contacts it really well and actually does a thorough little puncture. So you're going to take an alcohol pad and you're going to wipe the side of your patient's finger like this. So you're just going to wipe it off, and then you're going to take the kind of long little pointy plastic piece, twist and pull, and you're going to just get it out, and you can just throw that away. And then you're going to put this up against the side of the kind of the fatty part of the tissue there, and hold it nice and firm, and then push like that, and then you're going to get some blood right away. And so kind of massage it to make sure blood's coming out, and then you're going to get this in there, put it up here, hope you guys can see it, and then it's counting. I don't think I did it so you could see it. It's counting, and then mine is 99. So that's higher than it was when I did it a second ago. But you can see it's still bleeding really good. So if you do happen to get an error, you would probably have several opportunities to actually, if you puncture really well, you'd probably have several opportunities to actually get in there and do it again. So that's kind of the trick, is to make sure you have a nice lance, massage it so you get enough blood, and then put the little test strip into the glucometer, and then go in right away and get your blood sample. And it should be hopefully easy as that.